This film has been made by Opaz Multimedia and Health Talks Ltd, commissioned by the Waltham Forest Council Public Health Team, and made possible by a grant from the North East London Health and Care Partnership, with special thanks to our production team.
So my name's Alex Shepherd and I'm a registered public health professional. The majority of my role is working with more senior public health professionals, workforce development, and I also work with the Youth Health Champions, which is the future public health workforce. I started working with Youth Health Champions back in the mid-noughties whilst working for a public health team in Essex. We'd identified that a number of the issues facing young people were around risk-taking behaviours. The traditional approach of a professional coming in and talking to the young people about you mustn't do this and you mustn't do that really wasn't working. And we trialled a peer-led approach where we train up a group of young people to really consider and deliver those health promotion messages in a different way. When the programme first started, we were focusing quite a lot on the risk-taking behaviours. So looking at reducing the rates of teenage pregnancy, substance misuse, alcohol misuse. Whereas now the young people tell us that they want to focus more on improving well-being. And that really makes sense, because if you improve the underlying mental well-being of a school population, the young people have the skills and the confidence to be able to make informed decisions about whether they engage in risk-taking behaviours and are less likely then to do so.
I'm Catherine Hutchinson. I'm a Senior Public Health Strategist at Waltham Forest Council. I commission and support the Youth Health Champion programme in Waltham Forest. The Youth Health Champion programme is a type of young people social prescribing model. So social prescribing is where an individual is linked to a local wellbeing initiative to help boost their health and wellbeing. And so that's what we do with the young people. We train them up to be those link workers, to know about local initiatives and wellbeing services.
The Youth Health Champion programme has benefits for multiple stakeholders. These are the young people themselves, schools and public health. The benefits to young people include the fact that they gain a qualification that gives them UCAS points. They also develop their leadership, communication, presenting and team working skills, to name a few. And I've seen firsthand a huge difference in their confidence. I'll never forget seeing one group of Youth Health Champions in particular who I first saw present, and they were a little bit wobbly, a little bit worried, but fast forward 3 months later, they were stood in front of a whole panel of adults and they were presenting with such poise and professionalism, and it was just incredible to watch. I was just absolutely blown away. I've also seen their ability and understanding of local services increase, and also their ability to navigate the complex health and care system. We've seen the impact on their own lives through taking personal positive action, as well as influencing with their family and friends. For schools, the Youth Health Champion programme contributes to creating like a whole school approach to health and wellbeing, which reinforces the content in the curriculum. It ensures pupil voice and co-design, and the information is up to date and tailored to other young people. The champions become advocates and role models, not just within their school environment, but also with their primary feeder schools and also within the local communities as well. The earlier we can support young people to become self-aware of their health and lifestyle choices and access the services they may need, the more likely we are to prevent health issues in the first place or the worsening of them later on down the line, and that is a large part of what public health is about. There's been lots of highlights and achievements of the Youth Health programme in Waltham Forest, which has been running for the last 4 years. So there was an amazing period poverty project which won a Team London award. We saw the development of the first mental health charter in the borough, and also the creation of the first mental health summit, #ForestMinds, which won a Team London runner-up award. A violence against women and girls campaign called Stop the Silence, which won a Royal Society Public Health Award. And subsequently, one of the lead champions of that campaign, Jessica Tung, became the first youth member of the RSPH board. There was also a school that collected 1 tonne of food for a local food bank, which was absolutely amazing. They've also been running workshops for key worker children during COVID around kindness and emotional well-being, and they've attended North East London-wide events where they've talked about all the benefits of the programme, what they want from the local healthcare system, and all the skills that they have been learning. There are also lots of other amazing and numerous activities like promoting kindness, promoting positive body image, and supporting exam stress. It is a fantastic programme which is reinforced by the number of schools that keep signing up year upon year. If you are considering implementing it in your area, I really encourage you to do so. You won't regret it.
Hi, I'm Jackie Bowers-Broadbent and I am the Executive Head Teacher at Buxton School.
What impact has the Youth Health Champion had on the past few years over the students' health and well-being?
Well, I think it's helped to raise the awareness of youth mental health. And it certainly has raised the awareness of our children's understanding around particular bodies that exist. What our children have been able to do is to hold assemblies, and those assemblies have enabled the children to lead the dialogue and to think really carefully about the conversation that they would like to have with children. And of course assemblies are a bigger forum, but then within that forum the children have been able to engage in that conversation. They've also been able to engage in conversation in tutor groups, which is a slightly more personal approach. We all know that sharing actually is a good thing, isn't it? It means that you're not on your own, and actually you realise that actually somebody else has felt that way. Somebody else has felt a bit depressed or a bit down or have had low mood. How did you get out of it? And that, I think, has been one of the benefits of having the programme in Buxton School, is that the reach almost has been broader and longer and wider, simply because of the involvement in the programme and how the Youth Health Champions have steered that programme with the leaders in Buxton School.
Would you recommend other schools to develop a Youth Health Champion programme? If so, then why?
Absolutely. I would say why not, really, in knowing that it would give your pupils and your school community, not just those that are leading, but those who become ultimately a part of the programme and are extended into the programme. It gives them so much. It gives them a sense of togetherness. It gives them a sense of actually we're all in this together and we're supportive of each other.
Are there any other points you would like to make?
The only point I'd like to make is just really to say how proud I am of the children who have been a part of the programme and how much they've thrown themselves into it, that actually they were the leaders from day one. They were the ones who felt passionate about the topic. They were the ones who felt determined to convey the message, and I can't be more proud of them. I've watched them grow and I've watched them develop as wonderful, conscientious, kind human beings. And I couldn't be more proud of them.
So, where do you start? YHC programmes are funded by either your local public health team or individual schools and community groups. The key cost is in the delivery of the training, as an accredited Royal Society for Public Health qualification is used, which is provided by a number of different organisations around the UK. You need to identify a Youth Health Champion coordinator from the school or community group staff team who will take the lead on recruiting and facilitating the team. Training delivery can be flexible and is usually delivered over 2 to 3 interactive workshops, some of which can be delivered online. Additional material can be incorporated into the syllabus depending on the needs of the community, such as vaccination awareness and oral health promotion. The Youth Health Champions are ideally aged between 14 and 21, and the training will be adapted to suit your team. You can find a list of training providers on the RSPH website.